Kia ora tātou and welcome to you all. My name's Adrian Tupatu. It's my privilege to co-facilitate this webinar. We thank you for coming along at this particular time. We really appreciate that it crosses all the time zones of the planet, and so we're really grateful for those of you who are turning up at this particular time, and acknowledge those of you who will be picking this up from a recorded piece. It's a fantastic opportunity for us to be part of the launch of the Global Public Health Week from today until next Friday, and also as an opportunity for the Indigenous Working Group of the World Federation to facilitate part of a suite of webinars that we are engaging in over the next period of time, months and years. Also acknowledging that this particular webinar is the second of our particular ones, and it's a really opportunity for us to collaborate with Victoria University of the Commonwealth of Australia, and particularly with the lecturer of the particular course that's happening, which is Penny Smith. We're very excited to be able to do those things and also have a stellar line of speakers and panelists today. So the original title of our this particular webinar, we tried to make it as long-winded as we could. So it's how can the application of decolonisation enable the rethinking of public health paradigms for public health, basically decolonising public health. We've got some, we're really grateful to have our speakers today, which are Kelly Owen. I will give a further introduction as they have a chance to speak. Also, Dr. Wando Maki, coming from the Republic of South Africa. Also, Emma Waimari-Rawson, Te Patu, the President-elect of the World Federation of Public Health Associations, and also Kisang Tringlek, one of these master's students from Victoria University of Australia. So welcome to you for people this particular evening. The kind of order of ceremony will be that I'm just going to take the opportunity to welcome you all in my native tongue, and also have the opportunity to welcome the speakers in the order. Emma will be speaking first. We're aware that in the next 30 minutes she will be joining a meeting out of Switzerland, and so she'll attend that and then return back to see how it goes. Then after that, we're going to invite Kelly, then Wando, and then have some reflections from our student. Then we'll have a summary from my co-chair, Dr. Lanagor. And so what we'd like to do is not just have the hour of the webinar, so we've got the facility to flex it out a wee bit more. So I'm really appreciative also that we have Maria from the office in Geneva. Before I kick off with that, I'll just start off with a blessing and an acknowledgement of in my native tongue. Nō reira, nā maunga whakarakaraka tū hono mai koutou. Nā tūpuna tū tonu ki te taha uro tu wakatapu, ei toka ahuru, ei toka marino, whakakapoa mai e koutou o koutou korai hoka teo hau a tihei mauri ora. So I send well wishes to you, not just from where we are in the bottom of the South Pacific, where I am at the moment, acknowledging all the people's lands that you are on in this place, acknowledge all your ancestors that have brought you to this place and the long shadows of those, acknowledge your mountains, your rivers, your seas, your deserts, and your skies and the various constellations, including the big thing that's rushing across Mexico and the United States at the moment, the particular eclipse. So all those things, both of a heavenly body, so I acknowledge you in a metaphysical and place, and also in whatever the spiritual links are to you and your people. So welcome to this place. Nō reira tuaka ki te mihi atu, ka koutou e huhi mai nei tēnei rā, ukuranga tira o ngā hauwewha, horino, nau mai hara mai tēnā koutou, tēnā tātou katoa. In terms of some of the mechanics of the evening. We're going to invite you we have a couple of polls. So those of you on, you will see that a poll is coming up, a question's going to be coming up. We are going to give you a window of maybe only 5 minutes or 10 minutes to respond to that, so we can get a sense of what your responses are. And so so the poll, the first poll is around your location. So where are you attending from? And so if you would kindly pull that bit, and that'll give us a better sense of where you are coming from. The next poll I'll introduce later on. So without further ado, and I'm going to acknowledge and invite Emma Waimarie Rawson Te Patu to speak. Amongst other things, Emma is the president-elect, so next month she will take up the position as the president of the World Federation of Public Health Associations. We don't assume that people are aware totally about the organisation. It's a small civil society. We have an office and a staff group in Geneva. We were a representative of over 100 public health national associations across the globe, with a collective membership of maybe 5 million people. And so it's a privilege to acknowledge Emma as the first Indigenous woman president of the World Federation very, very soon. Amongst other things, Emma is quite comfortable in introducing herself. She has a number of other roles. We kind of do that where we come from. We're quite comfortable around introducing ourselves. So I'll let Emma take care of that and invite her to speak. Nō reira, tēnā koe, Emma, and welcome to this hui.
Tēnā koutou, tēnā tātou katoa. Tēnei te mihi atu ki a koutou ko tai mai I te pōnei. Te mihi tuatahi ki ngā tangata o tēnei whenua ko ngā tai ki tāmaki. He mihi anō nei ki a koutou katoa ngā iwi take huri noa I te ao. Tēnā koutou, tēnā tātou katoa. Ko waio ko Ngāti Rangi Nui, ngai te rangi raukaua me Ngāti Haua. Emma Waimarie Rawson tōku ingoa. Or Emma Waimarie Rawson Te Patu tōku ingoa. As Adrian has said, good morning, good evening, good afternoon, wherever you are on the planet at this time. It is my very real honour to be here on this webinar this evening with you to talk about a really important subject in terms of decolonising public health. And also just like to refer again to Adrian's honouring of the position which I am about to hold, first Indigenous woman president of the World Federation of Public Health Associations. It's an incredible opportunity to talk about and highlight not only the issues that we as Indigenous peoples around the planet face in terms of our inequities, but the solutions that we offer that we have always had and hold. We have been very fortunate in a very short space of time in terms of the Federation to create a space for Indigenous voices in public health, Indigenous voices generally to be heard. In regards to that, I would say very clearly that we are very conscious that those of us that have started this work at the Federation level are very aware that we are Indigenous people from first world countries, and that there are many other faces of indigeneity, and we want to recognise those here. And that these webinars that we are running, the one that we ran last year that's been mentioned in the chat already, this one, and then a number to follow on through the rest of this year and next year, are about acknowledging and asking any other Indigenous people who want to be part of this very important conversation, unpicking what it means to decolonise public health, unpicking what it means to decolonise ourselves in whichever space and context we happen to be in, whether we be Indigenous or non-Indigenous, is a very important part of addressing the inequities that exist on our planet. In terms of where I fit, generally, Adrian said I'm very good at introducing myself. I do a number of things here at home in New Zealand. and one of them is helping my fellow New Zealanders understand their place in regards to the treaty that we have here in Aotearoa, New Zealand. There are a number of things about our treaty that are really important, and these two things I would say about it. The first thing is that it's a human rights document, and I think when we're talking about decolonising public health, or we're talking about decolonising generally, the really important part is understanding our right to health and the language of human rights. In particular regard in this conversation, for me, is around Indigenous rights and Indigenous rights to health. We are fortunate enough to base our work on helping people understand their responsibilities and obligations to our treaty. And essentially, as I said, that's about understanding our rights and obligations to upholding the human rights of ourselves and others on the planet, and how we do that as individuals, organisations and systems. And what I really am here to highlight this evening, and then hand over to the other esteemed panellists, is, being able to work within systems is a really challenging one that we are all very, very aware of in our spaces and places. No matter which face of indigeneity we hold, or which face of ethnicity we hold, or indeed as allies, or as in New Zealand we talk about Pākehā or white New Zealanders. Our duty is to understand systems and to dismantle the systems of power that uphold the current systems that don't serve us well, that have ultimately been created by the colonised systems that we have all had to live with for many hundreds of years. The Federation is a really good example of how it looks to lean into bravely and authentically to understand the journey of an organisation that is primarily European and American in its nature, and its greater part of its population, of its practicing population, is not Indigenous and has, for want of better words, a lesser understanding of what it means and the importance of decolonising public health. So for me, very real opportunity to help to support a community of 5 million members of public health practitioners is a massive opportunity. And so I would like to thank, in this regard, the Indigenous Working Group of the World Federation, who is helping to support a plan of work over the next 2 years. It has already been 2 years of laying a foundation, but over a continuing 2 years when I take on the role of president, to help our federation understand and learn about what decolonising means, and also to help to develop some tools and education resources that can help those associations help to educate their members. So we are very much on a path to supporting our federation in that regard. One of the first big steps we've made, apart from ensuring that our voices were at the table where they are currently, is defining for ourselves as a federation what it means to decolonise public health. Now, we're really clear that this is a beginning point, and that for anything that's huge and crunchy like this, there needs to be a beginning point. And our definition for decolonising health or public health was the beginning point for the Federation to put a stick in the sand about what it's going to do as an organisation of 5 million public health members globally. The definition can be found, I think, inside some of the links that we've sent out during the lead up to this webinar, but I'm just going to read very briefly. And again, a reminder, this is a starting point, and we see it as a very much living definition. And again, inviting anyone else who's interested in this work, in this space, to join us and add their voice to the work that we are doing, knowing again that we are, those of us that have drafted this, are one face of indigeneity. So this is the definition that we have currently drafted. Decolonisation is an individual and collective process that requires active resistance to forces of colonialism that perpetuate the subjugation and or exploitation of Indigenous minds, bodies and lands. Decolonisation in public health involves dismantling colonial structures that perpetuate inequities in health and determinants of health. Decolonisation necessitates transforming or developing new systems and structures to realise Indigenous liberation, self-determination and well-being. So we are driving forward on that basis, understanding where the power sits, redistributing where the power sits. And importantly in this conversation is for everyone to understand the context and where they fit, where they come from. And more importantly means everyone who's involved in this conversation and this work understanding the history of the context of where you come from. Without those two things, it is impossible to understand and engage in the action that is required to move forward. And when I say that, impossible to understand and engage in the bravery that's required to take on those actions to move forward. I'm going to go back to the Federation and the Federation's bravery and just give a couple of examples about why I believe they are succeeding in this global space. That is one that is filled with lots of complexities around addressing and attacking this issue bravely, and that is leadership, authentic leadership, and an authentic desire for an organisation such as the Federation to actually want to understand what this means, to want to understand the experience of Indigenous peoples, to want to understand how they can best action work that is going to reduce, if not eradicate, health inequities for Indigenous people, and thereby supporting the removal of inequities for all people. Because as we say here, if you do the right thing for Indigenous people to undo the inequities for Indigenous people, you're only going to raise the health of everybody else. And that comes back to understanding holistic approaches and Indigenous ways of knowing and being. And when you look at public health and the values of public health, and you look at the ways of Indigenous knowing and being and holistic practices of social construction and ways of living, actually all of those things that public health draws from in terms of its values and its actions can be aligned to Indigenous knowledge. So I'm not going to say much more other than, my main point in this whole conversation really is when we think about decolonising, we need to really know and understand the place of Indigenous people and the effect on Indigenous people in the first instance in that whole conversation. Because if we don't do that first, then we cannot understand the process at all the other levels and layers of complexity that it is after that. So I think that's enough from me, and I would like to hand it back to Adrian and say thank you very much again to all of you for attending this really important conversation. It is important that we are here, that we are having these conversations, that we are present, and we use and exercise our voices as much as we can, where we can, and that's what we're doing here tonight. So thank you very much, Adrian, and thanks to the rest of the panelists. Kia ora, everybody.
Well, thank you, Emma. When you were talking, I was reminded about a couple of things too. That one of them is that Indigenous rights are human rights. So it's an opportunity for fellow global citizens to get a sense of who they are relative to the rights and opportunities for Indigenous folk. And also, that decolonisation is really important. Again, it's a gift to non-Indigenous people as we go through a process. But also that decolonisation is not the panacea for all the ills that have happened for Indigenous folk in their various places. So thank you very much. Can I also just acknowledge that, and Emma alluded to it, the United Nations recognise that there are in excess of 400 million people identified as being Indigenous on this planet. One of the things that Emma alluded to was, of course, that there are two kind of conspicuous faces of indigeneity. There's the one that presents itself in terms of those who belong to first world and developed countries. We probably only represent 20 of the 400 million Indigenous folk. And so we're also speaking from a place of safety that allows us to be able to say things that are not entirely the opportunity for our fellow Indigenous folk in this space right now before we expand and extend ourselves. Can I also say that, please, if you have questions, that rather than have arranged questions, we've decided to take questions from the floor. And so if you feed into the chat any questions, Penny Smith will pick those questions up, and then we will come to that after the speakers have spoken. So thank you very much for that opportunity. Now it's my privilege, so thank you very much, Emma. It's my privilege to invite Kelly Owen to speak at this place, at this space. I want to acknowledge Kelly is an Indigenous cousin from Australia, and she's involved as a National Community Engagement Coordinator for the National Indigenous Kidney Transplantation Task Force. She's also doing a PhD out of the University of Adelaide. And part of this whole, our privilege is to have someone who's not only on the ground, but can think and describe things at a practical level for all of us, as well as being part of the in an academic space as well. So, Morena tēnā koe, Kelly, and welcome to the Sui.
Thank you, Adrian. Nanawi Michi Keliari Owen, Napi Garna Naranga Narangeri, Napi Naturcho Tadanyanga, Napi Lewin Pombarok Narangeri Rui. My name is Kelly Owen. I'm Garna Naranga and Narangeri from South Australia. I live in Murray Bridge and my birthplace is Adelaide, or Tadanyanga, the red kangaroo. I feel really privileged to be here tonight and be invited from Alana and Penny. So what would you like me to talk about?
Kelly, do you want to start off with talking about your patient journey and share with us about the relationship between decolonisation and your journey as a patient who moved into research and advocacy, recognising that decolonisation is new to you and you're new to the land of research?
Very new, yeah. My background is I'm a primary school teacher of 25 years and transitioned over into health and research 4 years ago. I stepped into transplantation because I sat on dialysis for 3 years. I did perinatal and then I went into hemo, and then I had a transplant nearly 9 years ago. My youngest son, we have Allport syndrome, and I, as a carrier, my youngest son was also going through the system, the health system, in terms of sitting on a dialysis machine and having to go through transplant. But what I found sitting as a patient, how complex the journey was for me without a navigator. I was constantly asking questions, but I felt that I was in a privileged position because I was assertive and I knew the questions that I wanted answered. And then it really flipped when I became the carer for my son and tried to navigate the system in the Women's and Children's Hospital and transitioning into an adult hospital. It's very white, very sterile, very unwelcoming. A lot of language that was used wasn't broken down. You know, they've studied medicine and that wasn't my forte. And using that language to me and my son, who is also deaf, in between COVID with a mask, was really hard to get informed consent and information. So a part of that has led me to, we put in for a Medical Research Future Funds grant, and we're now coordinating 4 sites across Northern Territory and South Australia for patient navigators to help people along the journey from when they're first diagnosed to post-transplant. So we're working from Darwin, Alice Springs, Port Augusta and Adelaide. And I feel really passionate of being able to walk alongside somebody in their journey, knowing what they've been through and taking away that anxiety, making them feel comfortable, sitting and having a yarn to explain it in ways that they can understand. It's not dumbing it down. It's talking from heart to heart. It's having compassion and empathy for someone going through that journey who is quite sick. There's a lot of grey brain, we call it. And, you know, to retain that information and go and inform family, because family's the one that is caring for us, being able to inform our mob and talk about what are the best options for us. You know, it's a lot. So yeah, I just wanted to make sure that anybody else coming through this journey didn't experience what I did, and I tried to change it as best I could for my son. And now my responsibility is being able to give it back to others. We've got a model that is working, and we want to see that grow on a broader scale across Australia.
Thanks, Kelly. So tell us about what it's like to think about doing a PhD in decolonisation when the ivory tower is new for you and public health is new for you. A lot of us here at this webinar, we've been in public health a long time, but this is new, and decolonisation is new. And you've been in advocacy for a long time. You've worked in language and protecting language for your community. So talk to us about the ivory tower, the big words, the intimidation.
Yeah, you know, it's walking into meetings, and these people are pretty fast paced, want to get down to business straight away, and there's no introduction or connection. So I don't have trust walking into these meetings with these people who are wanting me to make decisions when I can't make decisions. I need to go back to my elders and my community and discuss it. It's a completely different way that I've walked into. Again, very white way, because it doesn't feel natural. I think it's feeling very rushed and tick a box. We've done that. We've included an Aboriginal person or a Torres Strait Islander person. We can move on. I think they're very disconnected from what's happening on the ground and walking the journey, or feeling that they can understand what we're going through. The PhD side of it and the academic side of it is new as well. It's been, you know, a good 10, 20 years since I last studied, and coming in and understanding academia, getting the information that I need. I feel like there's so many levels and layers to answering a question. Well, I'm answering a question, and that person I'm thinking should know in that position. You know, it always seemed to get directed somewhere else, and I'm off to somewhere else, and it's just these crisscrossings, and it's very complex. I wish that was a lot simpler.
Thanks, Kelly. I've got one last question before we hand it to Adrian and to move on to the next panel member. Recently, you went to Healing the Spirits Worldwide, and this is a global webinar. So we've got people tuning in from around the world. How are you thinking about decolonisation and sovereignty, both for your community, Nunanjeri, Ghana, Garanga, and then globally for you as a member of the Indigenous community, the tribal community, the First Nations community?
I felt very privileged and honoured to be on Salish country, because the energy and the vibe and the healing that was happening at that conference was nothing that I've ever experienced before. So to be able to bring it back and start talking about the healing that needs to be done locally and what we can contribute is on the agenda across the 3 sites and projects that I'm working on. It's about, it's bigger than us. It's bigger than our communities. But as a collective coming together, we have that strength and that agency to be able to change the ways in which things are happening. Being able to have the songs and the language and the unity of other brothers and sisters across the world. We're not alone, and I really felt that in Vancouver. So that was an amazing opportunity.
Fantastic, Kelly. Kelly, I'm going to ask a question that's a bit Australian-centric, really. Just appreciating that across the Commonwealth of Australia, you've got various jurisdictions at a state and territorial level. And so do you think it's easier for the kind of changes that need to happen at a territorial level in the Commonwealth of Australia, or for these decisions to be made in Canberra?
I actually sit on the Organ Tissue Authority, the Parliamentary Advisory Board. I would say local level, definitely, because it's actually, you're seeing those actions, it's tangible stuff happening, whereas it's taking forever to get decisions made, and for people within Parliament or within Canberra to actually understand their own system, let alone give us a decision. So I would be definitely saying local.
Right. And my final question is really, so, you know, when you're talking to your own people, you know, your own mob, so what do you say to them about the kind of things that need to happen? I mean, there are things that they obviously know, I guess, about changes that need to happen. Is there anything particular on the journey that you're in right now, as both your medical journey, your familial journey, and now this academic journey?
I think it's really making sure that we're our biggest advocates within the health system. We need to know that we have the power and we can take that
already coming up. So look, now it's my privilege to invite our next speaker. You know, if you were to use a descriptor of a number of people in leadership positions who are associated with the Federation across the planet, one descriptor is kind of like sociometric stars, people who are quite significant in the various pockets of what they do professionally and who they are and what they represent. So I want to acknowledge Dr. Luando Maki, who joins us from the Republic of South Africa. I really appreciate that you've just come from yet another webinar to be on board with this, and Wanda, amongst other roles, he's the president of the Public Health Association of South Africa, and a myriad of other roles. But I'm also aware that you were actually at COP28 recently, both as the co-head of a delegation of the World Federation of Public Health, but also with the World Medical Association delegation to COP as well, COP28. So welcome and thank you for joining us today from the Republic. Kia ora and tēnā koe.
Thanks, Adrian. Hi, everyone. So just to, maybe I can just chat a bit. I'd like to, thank my Pacific counterparts from inviting me from Australia, New Zealand, and the other countries there, and also from the Indigenous Working Group for World Federation of Public Health Association for this important topic. And I want to give an African perspective to this topic of decolonizing and the paradigms of public health. And, the first one is just to set the setting a little bit. If you want to go in terms of a historical context, Cato the Elder in 146 BC in Rome was a Roman consulman and senator. And he had said every time he made a speech, Carthage est delendem, which translates loosely to furthermore, I consider Carthage must be destroyed. Carthage is a great city from Africa, one of the greatest in our history, and it had fallen. And what we are trying to do in Africa now is terms of trying to rebuild our health of our people so that we can be able to achieve, again, another Carthage. That's not just in Tunisia, where Carthage was, but for the whole of Africa as a whole. And it goes to other philosophical leaders within Africa, where the importance of health is emphasized, such as when Nelson Mandela said, health cannot be a question of income, it's a fundamental human right. And Kwame Nkrumah from Ghana, who said that the welfare of our people is our chief pride, and it is by this that my government I ask to be judged. So we are trying now as a continent to be pushing towards a better health. And in terms of decolonizing that, I'll further zoom into a South African perspective. The South African postgraduate public health training dates back to 1940s, with most of it being related to community health and the Community Health Institute. Unfortunately, right around the 1960s, due to lack of support from government, it closed, but it was reinvigorated in the postgraduate sector within the community medicine, and we have a lot of public health medicine specialists. In terms of currently what's happening for public health training is that we have three types of universities in South Africa. We have traditional universities, and then whose theoretically offers university degrees. We have University of Technology, which offer vocally oriented degrees, and we have comprehensive universities. And in terms of MPH programs across South Africa, they're mostly offered in full or part-time basis. But there are some challenges in terms of having consistency in terms of one standardized program. So we have variations in between. and other challenges relating to the quality within each program. In terms of decolonizing training of public health, I want to make a disclaimer right now. I have no crystal ball and I cannot answers at once. And I think this type of webinars is just a start in moving in the right direction. But I can add two things which I think are quite vital to try to address this. The first one is that we need to change what we teach and adjust it and be able to use some of our own cultural and ethnic local stories to be able to share in terms of what in a South African and also culturally native South African context, what are the different health changes we'd like to see. And so that it can also be easily the other be that we'd also want to change how we actually teach. In Africa, a lot of our teaching, especially so,
Just a slight lag.
sorry, there's a little bit of a network glitch. Okay, is it better now? Is it better? Oh, fantastic.
Yes.
So the first one, as I said, was to change what we teach. And I said that making sure we use stories within Africa, within our cultural context, and so that we can be able to have everyone to understand it at different levels and not to only those who've had a westernized education-based system. That's one part of it. And also the other one is language, in terms of making sure that it's also, we have 12 languages in South Africa, but we have 3 predominant languages that we mainly speak, Xhosa, and then also Zulu is one of the bigger local languages, which we want to make sure that the mediums across universities should be used for access to our native populations. The other part is to change how we teach. We do a lot of teaching in terms of Western lecture theater, sitting down and being able to teach the people. But in a lot of the context of South Africa and Africa, we do it around in a circle in terms of us sharing stories within the teaching situation as a conversation amongst people. And that's how we actually have even our tribal and traditional laws within South Africa have been passed down through mouth and having those discussions. And those are the few starting points we can do. The other third one is that we need to also decolonize how we do funding within research and try to emphasize some of the indigenous and local explorations in terms of medicines and try to untap that resource that we have not really done so. And also to have a lot of solutions that come from Africa, and that's in a global sense, meaning that it is good to see how some of the translations of research globally, but to also see how our own research can have solutions based on our own African research. And I think that's something that relates to funding, and it's something that is not just restricted in terms of our constraints as a continent, but also to try to see if we can be able to get more funding from globally to help us in our direction of decolonizing. So maybe I can stop there for now, just to give a little bit of a background and also giving an understanding of where we can start. And then I appreciate a few questions that I can maybe elaborate some more. Thank you.
Fantastic. Look, thank you very much. Look, a lot of stuff to pick up there, and I see there are a number of questions that are coming up. What I might do is take the opportunity. Yes, I think it would be good if I just ran through the questions after our next speaker. But you've raised a number of issues that I think would like to talk to, particularly or respond to. But keep bringing the questions in, people, and Penny's just lining them up so that we're able to have a look at them. And I've got 3 of them I'm particularly interested in acknowledging. I'm going to take the opportunity. So thank you very much, Wanda. A lot of food for thought and some stuff that really is around what it kind of looks like, not just in Africa, but some really important things for us to think about and launch from, as you alluded to. Look, I'm going to invite one of the master's students from Victoria University to speak now and give some reflections. So Kisan Tringlek from Bhutan, who's currently a student in Victoria. Would you like to give some reflections? And then I'm going to go and offer questions for the panelists, for all of you. So kia ora. Welcome.
Thank you, Adrian, for the introduction. Before I speak about myself, I'm currently on Naam, which is the traditional name for Melbourne, and I am on the Wurundjeri Wurrung land, and I pay my respects to the elders past, present, and future. And now that I know more about the Indigenous culture, I feel that it's more and more important that I acknowledge where we stand. Kudzang Pula, everyone, which means I wish you good health in my native language, Songkha. As a Bhutanese student pursuing the Masters of Public Health in this colonized land of Australia, I'm deeply grateful for the opportunity that has been provided to me today to give this reflection on this landmark webinar on decolonization in the field of public health. So coming from a country that was often perceived as never colonized or never been colonized officially, I have now this understanding of the impacts of colonization, like seeping into the systems and structures that shape the health and well-being of our communities. Growing up in Bhutan, I always assumed that our nation has somehow been like spared from the effects of colonization. But however, upon like deeper reflection now that I know a little bit more about colonization, I feel that the Western models and approaches, it did seep into our small Himalayan kingdom as well. So if I give an example, the Western medicine and also the way the industrialization has affected our country, and there is this presumed superiority of these imported methods that has like, oh, sorry for the lights, that has led to the gradual erosion of our indigenous knowledge, practices, and the ways that we have been practicing in the past. So through this webinar, I've like gained a really deeper appreciation and the nature, I mean, like why we need decolonization. It is not just about like dismantling the colonial structures that are there, but also it's about the painstaking work of rebuilding the systems again, and that are like truly responsive to the needs and priorities of these the indigenous communities. So listening to the indigenous public health leaders who are in their own rights like public health heroes today, so it was really eye-opening for me, and it really has stimulated some thoughts from within. Emma emphasized about developing a flexible and living definition that centers indigenous knowledge, values, and voices. That really resonated with me, because decolonization is an important first step to assert like indigenous expectations and experiences, and to also have this definition guide other non-indigenous public health practitioners and organizations. I feel that that's a very important topic that she touched on. And she also talks about having important, like the importance of having conversations. And I think this platform has been like it's the start of the transformative changes that we can make in the decolonization in public health. And yes, Kelly, she also gave a case study during our systems thinking unit, and she's a hero in her own right, yes. And she gave a glimpse of her lived experience, which is like a perfect example of exactly why we need decolonization in public health in the first place. I do applaud her for raising her voice and using her platform to raise awareness and for the decolonization of public health. And Das Lawando, he gave the perfect African perspective of decolonization, giving the historical context of rebuilding the health of the people, which is really amazing. Because yes, I've heard about the Australian context, but the African context was a little bit different. And he also talks about how health is a fundamental human right, regardless of our background, which is really, which is also what I innately believe, that it should be, health should be given, provided to everyone, not just to like the people with like high social economic background or where it's accessible, right? It should be for everyone. And he also talks about the changes in the education systems, that using the native language and storytelling, which is why I would want to give a perspective from me as a student, so that now that I have a broader understanding of like the importance of decolonization and how it is a very new concept, which decolonization itself is a new concept, but the indigenous concepts are like dates back in history. So what I believe is that it has made me wonder why I'm learning the decolonization concepts in detail just towards the beginning of my second year, which I feel that decolonization is such an important topic that it should have been introduced to me in my first year. And like in the beginning of our course, all the teaching materials and the curriculum were like predominantly westernized, or like the colonial models of public health and systems were taught to me. And there was like, there's always this acknowledgement of land, country, but we didn't get the actual weight of what it meant until we did the systems thinking unit, actually. So it was we also got the feeling that certain populations were like reviewed as a problem, or they had barriers that they needed to overcome. So I think that really reflects the colonial legacy that is left in public health. And also there is a lack of indigenous representation and voices in the curriculum itself, because so we didn't get any like input from Aboriginal and Torres Strait Island communities. It was like a very minimal and limited. And they also like talked about like Aboriginal and Torres Strait Islander people and how their health is poor compared to the white public. So they talked about it in every session. It was more like merely a token, because we were never given the understanding of why that was so, and like what is the way forward. It was more like just that you have to learn it, rather than giving the importance of why you had to learn it. So that's also one of my observations in the whole Masters of Public Health course that I'm taking. And I feel that we were not given the overall comprehensive overview of the Australian health system and how the organizations worked, and also how the indigenous organizations come into play. So with this, I want to say that as I continue my journey in the global public health course, I'm now like really aware of the responsibility I hold, and I feel that by like forging genuine partnerships and elevating the community voices, I can like aspire to be a catalyst in the decolonization of public health, not just in Australia, but also my homeland, Bhutan. Thank you. Kadinche.
Thank you very much, Kisang. It's very refreshing hearing someone starting at a graduate level. Your descriptions are quite wonderful, and it's exciting knowing this is part of building and maintaining and increasing the momentum in this particular space. So thank you. Look, I'm going to take the opportunity to grab a couple of the questions. I'm going to start with some easy runs on the board. So one of the questions that came up first was, what is your vision for the definition and where do you want to go? I presume the definition of decolonising public health. So can I invite any of our speakers to offer a response to that? What is your vision for the definition? Where do you want to go? Just turn on your mic and go for it.
Oh, thanks, Adrian, and thanks for the question. I think, with those when you define something, I think it has to be all encompassing and also all acceptable to people. And I don't think it's fair to come to an offhand, straight definition. But what I can say that there are certain key points that should be in that definition. One is one of equity. The second one is about respect and acceptance of all cultures and backgrounds. The third one would be in terms of not incorporating and having a basis of education systems to be related to the indigenous people. And I think the last one that I think of that would be that it must be a real commitment to decolonization. I don't think it should be just a letter and wording. There must be a clear, real commitment. And in terms of that, it translates into legislation. And so that by law, it should be there. That's what I think the different ingredients that should be there, and not limited to that. And that's what I can contribute for that question. Thank you.
Emma.
Kia ora. Thank you, Lawando, for your it's all relevant points in relation to what needs to happen. And in terms of the definition that we've come up with in this instance, it very much was that beginning to, how we begin to address this subject matter in this particular space of the Federation, and giving us a starting point to grow the conversation into different spaces and to adopt different ways of ensuring that it's integrated into all of the places and all of the systems that we need to see it embedded. And what I can say about the current one is it is a current working definition that we've come up with the Federation, the opportunities to build the different layers and facets that are required to reflect all of the other voices that need to be in the conversation around this are absolutely there. It just means that there is a level of commitment by an organisation of this nature to authentically begin to lean in and address its responsibilities to this subject. And the next step on this, of course, is we now have 2 policy position statements that will be going forward to the General Assembly of the Federation in May this year. One on Indigenous health, so understanding the context and history of Indigenous health inequities, and another one on decolonising public health. So for the first time in its history, it will have policies that will embed the notions and the concepts and the beginning of actions forward to address these issues as an organisation. So we're just talking, but we're talking about it at an organisation level. But I absolutely agree with Lawando, it should be something that is at some point legislated in every nation and state, so that it's a requirement of all of us to understand it and embed it. But of course, we need people to not shy away from the terminology, not shy away from the challenge. And this is what we're offering, is a place to have a conversation, to begin to be comfortable, to begin to engage authentically in all these very important things and points that everyone tonight has made about why we need to. So thanks.
Fantastic. Any other responses from our panelists? I might take the opportunity to acknowledge that the United Nations and the World Health Organization currently are acknowledging the importance of traditional knowledge from Indigenous folk. And when I say Indigenous folk, all the various myriads that represent indigeneity, and that's what they are. They're big global statements. One of the ways to deal with this is to have a number of fronts and a number of ways to start to arrest some of the situations and address the kind of things that have been alluded to tonight. So there is no one single answer. And I also say that because another great question that's come in is how can we comprehend the relationship between intersectionality and decolonisation? It's a big one. But actually you've kind of both alluded to part of that. I guess alluding to, it's not early days, but it is early days. And I might just give the World Federation, a Public Health Association, an example. Look, I am not the first Indigenous person to be, by definition, really, but the first that's acknowledged to be in that space as an Indigenous person. There was probably very little, if any, narrative coming from the Federation in that space for the 50 previous years of its existence. Our job is to give presence and be. And part of that is to take the opportunities that this fora and others have to be in that space while the great statements are being made in New York and Geneva that we need to have a presence in every way, shape and form, which means defining what it is as we move along, which is a great place. It's a place to acknowledge and intellectualize that, which is a power space. It's a really important place for academia to provide pace and momentum on this. And there's a place for people to be able to stand and acknowledge that this is part of a newer narrative that has been described by our panelists today. Okay, I'm going to jump to another question. Do we have models of deep, meaningful transformation of public health systems that address power redistribution? Most power over models cling to business as usual and commonly make only performative, cosmetic changes. Great thing to say to New Zealanders who are going through an interesting challenge right now. Any thoughts or comments? And then I've got one specifically for you, Kelly, a question that's come up. So any response to that particular question?
Oh, Lawando.
No, ladies first, Madam President, you can go ahead.
Yeah, I just wanted to say, Adrian's just alluded to something that's going on in New Zealand right now, and I guess what I want to say in the first instance of this is nothing can be unaffected by politics, but New Zealand has for many, many years been working on what we call treaty-based models or treaty partnership models for systems change and transformation based on people's responsibility and obligation to our Indigenous population here in Aotearoa. We've had a lot of success in understanding what that needs to look like, and Lawando's alluded to how we educate differently, what kind of knowledges we value, and having those, begin to be embedded in our systems, but nothing has ever come to fruition the way that we've needed it. And we've come closer to it in most recent times in the transformation and the reforms to our health system by bringing about a situation where we had Indigenous level at the central government level and decision making and commissioning at the central government level in terms of our ministry and the redesign of our health system. And unfortunately, it's fallen victim to a new neoliberal government. However, it's also shown us the strength of what we can achieve and the things that we can achieve. And it's also emboldened us with more desire to continue down the path that we know is the right one. It's also shown us that we have allies that are willing to continue to stand up and grow a greater wave of allyship through systems change. And I think that at the end of the day, it's going to take those continued waves of allies and those who understand what it means to be on the other side of the picture from us to continually push and be brave to ensure that we can get these systems that we know a lot about how we need them for ourselves to actually become manifest. But I don't know that I've heard of anything that's truly been successful yet. Kia ora.
Yeah, just to come on after Madam President-elect, I fully agree with her. I don't think there's a clear model that actually has worked. And I think there's been models which had some success, but the challenge is always the political will to continue it. And with change of leadership comes a change of restructuring of health systems. I mean, that's not immune to only lower income countries, also high income countries. I mean, America's an example, a change from Obama administration to the Trump administration, which had massive health impacts. And now with the latest law change within New Zealand also is an example of that. So it's quite challenging to say we can come to a place where that works. What I do want to say is that what we can try to do is try to have the right people within the health system, such as the permanent employees, that can try to keep structures that work well and try to be resistant. But unfortunately, even with that being said, they can be removed by those in political powers. So it's not a very lovely sunshine answer, but it's the truth. And it's good that you've raised up that question, because we need to be acknowledging those different challenges. And maybe it might be, I mean, there's a question we had recently at the South African Medical Association, where I also sit on the National Council, where we said that our challenges that we face with our government at times is that have increased with us having less members actually going into politics. I mean, it might be the solution, to be exact, that we might have to start, not sticking only in the non-profit, non-governmental space and trying to be inside those rooms where those discussions are held and those rules are changed, and not only protesting and advocating from the outside. I mean, it's unfortunate. I don't like politics, but we need to do something, and we got to start somewhere. Thank you.
Thank you. Kesang, I'm going to give you the magic wand. I'm going to give you the opportunity to make changes in your native Bhutan with regards to what might need to happen if there was a process like this required. I'm just acknowledging the incredible diversity both within your community. So there you go. Have the wand.
Are you giving me the power, Adrian?
I am.
I think in our So I feel that it would gain momentum because it has been given a place in the government itself. Since we have a director of traditional medicine, I think it would gain, it would be given the emphasis and the importance that it needs to be given. It also focuses on the holistic nature of well-being rather than the very patient to the doctor to patient approach that we have in Western medicine. It doesn't just focus on the disease part of the human, but more or less the overall well-being. And I find with what I learned about the decolonization concept of public health, I found that it is more and more important for me as a Bhutanese to also give importance or to preserve these traditional cultures. I have a dentist background, by the way, so I was always gearing towards the Western medicine concept. And I think this course and also this webinar, it's been very eye-opening for me in a way, because I always thought that Western medicine is so far-reaching, and it has brought tremendous changes, but it now, reflecting back, I feel that it is just more like a band-aid on a big wound kind of situation. And we really need to go back into our roots if we have to, and we have to preserve our traditional ways as well. Thank you. Thank you, Adrian.
Wonderful. I'm going to invite Kelly to give a response to a question that was specifically to you. Okay, so in the Windows reflection on teaching education about doing it differently, do you have examples alongside this in the kidney space? Alternatively, Kelly, how have you challenged and re-educated kidney health practitioners?
Great questions. Yeah, we've been working away at directing the way in which we want our model of care. And, we have set up a dialysis unit at a hostel. So our people coming off the land where their language is a fourth or fifth don't have to go into these big Western white buildings, because we don't feel comfortable, let alone it's like an airport and you get lost. But being in an environment where there is an open fire 24/7, that they can have dialysis there with other family members on dialysis as well. We have 3 chairs there. That's never been done before in Australia. And to be able to offer that service is where we're listening to people that actually have to come into our hospitals. They don't want to be there. It's too frightening for them. So to be setting up a model that works, we're growing that. You know, we're coming up to 6 chairs. We're doing organ cleansing ceremonies at the hospital to be able to thank donors and connect the new organ with the host. And, you know, we have white professors and surgeons trying to understand where we're coming from. And this is the way that we do it on Garniata. You know, this is a place-based situation. There's other areas that we feed into our hospital, and their ceremonies are different. A practical way that we're doing it within our hospital is we're doing decolonising practices in clinical spaces and educating leadership about the way in which we want our care. It's truth talking, and it's an opportunity for them to come together once a week and actually start talking about some heart stuff and understanding what decolonisation is. First, they needed to understand what colonisation was, and then breaking that down and having some real tangible and practical ways in which they can do that in clinical spaces. We have the answers. They just have to listen to us.
Awesome. Fantastic. Look, I'm just appreciating that a part of what we're doing this evening for us is I'm going to invite my deputy chair of the working group, Dr. Alana Gould, to give a summary. But I'm going to invite our panelists to give some final thoughts and reflections before I hand it over.
Thanks, Adrian. I think that I'd say a couple of things, and I think the first thing is, you know, and I've heard it a lot in this evening's conversation, is, you know, what knowledge is valued? How do we see knowledge? How do we impart knowledge? And I think more important than that is, you know, we can't do anything on this journey without acknowledging the existence of the history that brought us to the place that we are today. Without that acknowledgement, we can't acknowledge the grief that continues to cause the ongoing inequities, the grief that was caused by the colonisation. So acknowledging authentically how we got here is the first step to making the changes that we need to see on the global scale, on that whole transformational systemic issues. Thanks.
I'll go
Okay.
after you, Kasank.
Yeah, Kasank, you're up.
Sorry, I missed that part.
Any final reflections?
Okay. I'd really like to thank the World Federations of Public Health and Penny for pushing us and mentoring us for the whole event today. I just want to bring into attention that the witnessing this courageous effort from the Indigenous Working Group within the association has been really inspiring for me, and also like the commitment they make into centering the Indigenous voices have like made me realize that I could do that in my community too, and it has instilled in me that determination that me with a public health background can do so much more than what I could do as just a tertiary like a health practitioner. So I'd really like to thank everyone who have like raised the voices and have like started this platform, and also like started this concept of decolonization in public health, which is really needed and has to be voiced out and talked about ever so often, so that even people from the non-Indigenous community can also participate in it. Because I think health in general is for everyone, and it is really important for everyone to like make noise for decolonization in public health. Thank you everyone, and thank you so much for having me on this esteemed panel that I really look up to. It was a really fantastic opportunity, and I wish to learn more and yes, connect on a very personal level as well. Thank you.
Thank you. And I think
Thank
one of
you.
the, oh yes, please.
Oh, sure. Thanks. I'd like to, first at the end, thank Denka. I'd like to also thank Agnes, Kesang, and Aaron for organizing and being behind the scenes and supporting this. And of course, Penelope for driving it with Alana. And also the Indigenous Working Group. Thank you, Adrian. And also thank the President-elect, Emma, for also inviting us as the Public Health Association of South Africa. I'd like to also thank everyone for attending. I know that it's quite nighttime in New Zealand, and I appreciate for coming. I think in terms overall, I'm quite inspired. I do invite each of you to come to contribute to the rebuilding of Carthage for Africa. And also definitely we'll have a present for Emma when I meet her next, a South African Springbok rugby jersey. I know that it might be a bit controversial, I know, but we are the world champions, okay? We are the world champions. I hope also my Australian counterparts don't mind if we give you also, Alana, a top of the Springboks just for us, just to say thank you, South Africa. And we look forward to hosting you at the World Congress in 2026. And it's quite exciting to have you, and we really would love to have all of you to come through. Thank you so much. Thank you.
Thank you. Kelly.
I'm so thankful for the invitation and the discussion, to be able to direct counterparts that I work with, to these webinars on YouTube and hear the discussions and hear exactly, what's being said, for them to understand that this is bigger than us. We need other people to come in and have that buy-in that is authentic from their heart, and not challenge, but come on the journey as well. Lovely to meet you all. Really want to thank, Penny, Alana, everybody that's been a part of it. Thanks very much for inviting me.
Awesome. Okay, Alana.
Awesome. Well, I feel like everybody just picked the best summaries of their actual talks, but I actually found it quite hard to summarize because there's so much and so much interesting stuff, and I'm like trying to like write things down, but then listening and going, this is just amazing. So what I did was I kind of just put together some of my key things that I thought were pretty awesome that everyone said. So I thought I'd just highlight those rather than a big summary, which is good because you all kind of did summaries anyway. So Emma, I loved how you said that Indigenous peoples globally have the solutions already. This is an important point, as our knowledges are sacred and have been given to us from our ancestors. This is such a gift from us as Indigenous peoples to share for the benefit of all human and planetary health. I also liked how you emphasised the need for Indigenous liberation, self-determination and well-being, and that needs to be a focus, and that we need to have a holistic and systems thinking approach to decolonisation. Also, Emmy spoke about how we all need to understand the context of where we come from, as well as the history of the context of where we come from, and that those two things are vital to moving forward and truly decolonising public health. And then I also thought it was good, you know, that you also finished with a commitment from the World Federation to actually supporting, you know, the decolonisation of public health in an authentic way. And I think that's a really important thing that you've stated tonight. So Kelly, I just wrote here, wow. Thank you for telling us your personal story. That was really kind of you. Your lived experience of receiving healthcare in a very Western system that doesn't take the time to understand, quite frankly, where Indigenous people are coming from or our culture. And I love that you then spoke about how this is then why you now have such a strong commitment to making a difference for all, I wrote all your people, but all our people. Yeah. Yeah, and so you spoke about your commitment to making this different for our people in the future, and I know you're doing work globally as well, and I just think that's amazing. Yeah, and I love how you spoke about being new to public health and how you have found that the structures are not congruent with our Indigenous ways of knowing, being, and doing. I agree, and I found the same because while apparently I had been a public health researcher for 12 years, I didn't know that I was, so I felt like I was new to public health as well, but yeah. And I especially like how you spoke about the strength of the collective, and not just the collective like we talk about it in Australia, but also the collective of all of us, you know, all Indigenous peoples globally, but then, you know, allies and other, you know, local communities and that as well, and just how much stronger we are, you know, when we come together as that group and what we can do. And lastly, I loved your comment. I think I wrote this perfectly as a quote. So we need to take our power back. Don't let the system spit us out. I thought that was brilliant. So yeah, I really liked that, you know, that was a serious nod to self-determination and how important that is for us to have as Indigenous peoples, especially. And now Luando. So first up, I'd just like to thank you for gifting us with your African perspective on decolonisation of public health. You actually told a really interesting story about the history, but because it was so interesting, I didn't take notes. So I was like, oh yeah, and just like fully listening, but thank you for that. So I just, yeah. You also quoted Nelson Mandela, health cannot be a question of income, it is a fundamental human right. And this is such an important point, and one that has significant meaning globally, you know, across the different countries and different contexts, and, you know, has even more significant meaning in, you know, countries that don't, have, you know, access to healthcare. And yeah, so I hear what you're saying about the lack of consistency also, and how public health is taught, and how vital it is to decolonize, how we educate in particular. I liked your points around changing how we teach and how we should use local stories and teach in our languages as well. You know, that makes it much more accessible for our people. So I really liked that idea. And also the idea of decolonising our funding systems. So you gave the example of funding research into like our local and Indigenous medicines as well. But yeah, I also do not have a crystal ball, as you said, and we do need to keep this conversation going. And also, just on a final note, I just wanted to say how happy I was to hear so many people, or so many of us here tonight, talking about the importance of our traditional medicines. And this is actually a focus of my research program here in Australia. So I'm a little bit biased, and I was a bit like, yep, this is awesome. Thank you, everybody. But yeah, I think thinking about the theme for today around rethinking public health paradigms, I do think that, you know, tapping into our traditional medicines that we use is one of the ways that we can do that. You know, we've got a lot of, you know, underpinning fundamental ways that we do things through our traditional medicines that go much further than just, you know, taking a certain, you know, herb or whatever. So I think those things need to be thought about more deeply. Yeah, so that was, yeah, my summary. And that also finishes our webinar for tonight. I also, like the others, would like to thank Penelope for organising this webinar, and the students as well who came and also supported us. You know, it was an absolute pleasure working with you all and hearing your different perspectives on decolonisation of public health. I also want to thank everyone who's here with us watching today. You know, we really do hope that you have been inspired, to think more deeply about decolonisation of public health, and especially what it means for you and the work that you are doing. As far as next steps, we'll be uploading people's reflections of the webinar in the following weeks. The recording of tonight's webinar will be uploaded to the World Federation of Public Health Associations YouTube page, and it will also be emailed out to registered participants. And also end of May, kind of start of June, is an important time for the World Federation with the lovely Emma's inauguration. It's very exciting for us, with Emma being the very first, Indigenous president for the World Federation. It's a very, very important and special time. And lastly, I will hand back over to Adrian, who is the chair of the Indigenous Working Group, to send us all off good ways with a blessing. So thanks, Adrian.
Kia ora, Lana, that was sensational. As you people in Australia say, that was deadly. Look, I just want to also, so again, thank you very much to our panelists, Kesan, Kelly, Emma, and Wanda, a stellar crew. Also want to acknowledge the Victoria University crew, Danka, Akadesi, Kesan, Erin, and also Maria in our office in Geneva, and also Marta there. And I also want to acknowledge the continued support that the president of the World Federation of Public Health Associations, Luis Eugenio de Silva, gives us, and also acknowledging the other co-chairs of working groups for the Federation. Also want to acknowledge Dr. Professor Michael Moore, AM. I have to keep reminding myself it's AM instead of AI. So thank you, Professor Moore, who's been a fantastic non-Indigenous ally for that space for indigeneity and public health, not just in this Federation, but globally. So thank you all very much. And I'm also reminded that some of the things that I also want to acknowledge is that, the restoration of traditional knowledge is a noble action. And so it's really good that we're actually actioning it and capitalizing on the statements that are made at a global level. We give mana and action to that. And also that this is all about building momentum in the space. The gifts that we bring each other as Indigenous people is the gifts that we bring others globally into a global space, and reaffirms and reignites the fires across the planet of our people. So I want to acknowledge it, and I'm actually going to do what often happens. I'm going to invite Emma in possibly her closing action as the president-elect to finish our this particular webinar as we move into her taking up the position, to close it with a Māori acknowledgement and flourish, if you like. So nō reira, kia ora tātou, kei a koe te rangatira, Emma wā Māori e Rawson te patu.
Tēnā tātou, tēnā koe Adrian, tēnā koutou katoa, tēnei te mihi atu ki a koutou I te pōnei I te ahiahi I te ata. Māku te mahi hei whakakapi tā mātou hui, nō reira, ai o ki te whenua, ai o ki ngā tangata, ai o ki ngā mea katoa, tihei, Māori ora, peace to all things, peace to all people, and peace to the land. Go well, everybody. See you soon.